Morning sunlight filtered through the glass walls of a hospital in Singapore, casting a gentle glow over the crowded foyer. Nurse Ling adjusted her mask and prepared for another busy shift. The hospital bustled, rows of patients waiting their turn. Beneath the clinical surface, Ling saw traces of invisible wounds: fear, uncertainty, shame. Here, trauma was not rare. It was woven into stories of car accidents, illness, abuse, displacement. Ling and her colleagues knew this truth well, and they embraced trauma-informed care as guiding practice. The day began with Mrs. Tan, an elderly patient recovering from a fall. She'd grown withdrawn since her arrival. Her daughter, anxious and tight-lipped, explained in hushed tones that her mother had survived domestic violence decades ago. Ling listened carefully, not just to the words, but to the tremors behind them. She nodded gently, avoiding rushed questions or sudden movements, conscious that hospital routines might remind Mrs. Tan of past powerlessness. In the ward, Ling made it a priority to explain every step. "Mrs. Tan, I'm going to check your vitals. Is that all right?" By granting her patient autonomy, Ling fostered trust, letting healing begin with respect rather than pressure. She learned that trauma came in many forms: a harsh word, a shaming glance. And in Asian societies, such experiences were often unspoken, shielded by silence. Later, a young man named Ravi arrived after a workplace injury. He flinched when spoken to suddenly and had trouble making eye contact. Ling recognized signs of trauma, perhaps rooted in childhood or recent events. She created a quieter corner for Ravi, away from the noisy corridor, and gave him time to answer questions. Ling understood that culture and stigma complicated trauma, so she did not pry. Instead, she made space for dignity and gentle engagement. On the staff tea room, staff wrote reminders: care starts with safety, not assumptions. Ling saw her teammates struggling too. One nurse confided about burnout, haunted by memories of the pandemic's endless chaos. TIC guidelines encouraged staff to check in with each other. They shared tea, laughter, and moments of vulnerability. When trauma touched staff, leaders responded with open-door policy, flexible shifts, and workshops on self-care. The hospital's approach was not perfect. Ling noticed gaps, language barriers, hurried consults, but small changes mattered. Curtains drawn for privacy, soft voices, concise explanations. Change was incremental, shaped by each encounter. In a weekly team meeting, Ling shared a story about Mrs. Tan, emphasizing how trust had unlocked her willingness to participate in rehabilitation. Her colleagues reflected. Nursing led step toward establishing emotional safety and creating a trauma-informed environment. Let's get ready and change the way we deliver care to the patients.